Very good. Thank you. Mr. Chipman, it's not lost on me that as we're having this discussion with you or several members are about guns, that there is another mass shooting with fatalities near San Jose. We have worked hard. There are Republicans like Senator Toomey that have worked on the background check issue and tried to get that done. We know the vast majority of Americans support rational gun violence legislation. And a piece of this is for many years I've led the legislation to close a dangerous loophole in the law that allows domestic abusers to buy a gun simply because they're not married to their victims. This bill actually was included in the Violence Against Women Act over in the House and got a number of Republicans voting for it. And it's something that I think we can advance. Could you comment about that? Do you agree that we should keep guns out of the hands of all convicted domestic abusers?
Thank you, Senator, for this question, and thank you for your dedication to domestic violence, which remains the most dangerous call police will ever respond to. As an ATF agent in Central Texas, one of the most significant cases I worked was a pipe bomb sent by an estranged boyfriend to a woman who worked at a probation and parole office. So domestic violence is something that ATF agents regularly deal with on the job, and there's no greater threat than those offenders who have access to a gun. So it would be one of the top priorities I had if I am confirmed as ATF director.
Very good. Thank you very much. Ms. Milgram, I enjoyed our discussion, and we talked about opioids, something that I've been working on for quite a while with a number of Republicans on this committee as well as Democrats. What do you see DEA's role? We talked about the documents from a recent trial showing drug manufacturers mocking what they called hillbillies in West Virginia. I do suggest, I know there's shared belief on this issue, but this mocking of the Beverly Hillbillies song where drug executives were actually put in words mocking the people they got hooked on the drugs was an outrageous thing I'd never seen until last week. And it just shows how heartless this addiction was, where people were profiting off of people's own addictions, many times resulting in death. Could you quickly address what the DEA you see as the priorities?
Senator, I share your concern on this issue. America is in the midst of an opioid crisis, and fentanyl, which has now come to our cities and streets, is really fueling this addiction opioid crisis today. But I share your concern that there are two pieces of it. First, it's the pharmaceutical companies and the manufacturers and others that have essentially put us in a situation today where we must regulate opioids and the prescription drugs that people are being given. So there's a huge function in the DEA's diversion work that is a part of that, and it will be a priority for me. The other piece is really stopping the illicit fentanyl from coming into our country, where individuals who, most of whom first become hooked through prescription drugs, are then turning to heroin, to illicit fentanyl, and to other substances. And we're seeing just way too many overdose deaths in our country.
Okay, thank you. Last, Ms. Jadu, I really enjoyed our conversation as well. We talked about the fact that for so many of us in our states where we have needs for immigrant workers, permanent workers, temporary workers, and the like, this is becoming a near crisis, especially in northern Minnesota in our tourism industry, in some of our farmlands and others. We also rely on all levels of education from immigrants that are part of our economy. And one of those is in medical. And yesterday, Senator Collins, Rosen, Ernst, and I introduced a bipartisan bill that I've long been leading. I took it over from Senator Conrad when he left, the Conrad State 30 and Physician Access Act, which increases the number of international doctors trained in the U.S. to remain in the country if they practice in rural or underserved areas. I remind people that more than 25% of our U.S. Nobel laureates were born abroad, and 70 of America's Fortune 500 companies were started by people born in other countries. How can CIS help to ensure we are attracting talent to come to our country at all levels and work with us on this really crisis of not having enough doctors in underserved areas. One of the reasons you see Senator Collins and Senator Ernst join me on this bill.
Thank you, Senator. I really appreciated the time talking with you yesterday and when we talked about this issue. As you know, I worked on it when I was a Hill staffer back in the day on the House side, and I completely appreciate and understand this issue. And a family member, my father-in-law, came through a program, a little different, but somewhat similar, to assist in the U.S. Navy. So I can personally appreciate the program. Professionally from USCIS, what we can do is to ensure that the processing of the applications surrounding that is not something that is slowing down the process, that we are doing it efficiently and in an accessible manner, and of course to ensure the integrity and security of the system.
Excellent. Thank you all for your pointed and brief answer so I could get all my questions in. I appreciate it.
And the patience of your chairman.
Patience of our chairman. Yes.
Senator Hawley.